build sanitation facilities, but they will not have the money to pay for emptying what? Services. So we have been subsidizing for people at community level. We know that there are people in households there who may not afford to pay for a cesspool empty and come to their toilet or latrine and empty. So we have been subsidizing for them. So if instead of paying 100, what percentage have we been paying, Gloria?
We started where KCCA was paying 90%, then after we increased
10%.
Then we went 80, 20, then we moved to 60, 40.
So we implemented that for a long time. We began by paying for you 90%.
100%.
100%. Then went to 90. We reduced to 80. So we were winning the community off. So our assumption was that as we keep reducing, we are trying to change your mindset. We are trying to change your perception. And therefore we are onboarding you to start using the sanitation services, to start using the emptying what? Services. So we have been doing that. So are you following some of the things that we're doing at the community level? So we have a lot of activities which are helping us to improve sanitation. And we are saying equitable and universal access to sanitation services. Now, what are some? I'm just highlighting. There are many things that we have actually been doing at community level. In addition to health education, we do health education. We have been promoting. We know that we, as KCCA, we have the minimum standards, the minimum sanitation standards. We have the minimum standards that we expect. There is a minimum of how we expect a latrine to be built. We know that most of our communities, for example, most of the households, do not have lined what? Latrines. When they are building, they just dig a toilet and they put on the shelter without lining it. We know that as per the standards, that facility may not easily be emptied, isn't it? Yeah? You cannot use some equipment to empty that facility. So we have been implementing a number of interventions, and now we have what we are calling the community activation teams, which you can call the village health team, which you can call the community health workers. So we have been facilitating these community activation team members to go door to door in the slum areas and informal settlements to educate people about basic principles of sanitation and hygiene. Yeah? So we know that when we do that, when we have people educate you in terms of what you need to do, when we give you access to the right information in terms of what standards you must adhere to, when we subsidize for you to build a sanitation facility, when we subsidize for you to empty your facility, we shall be moving towards equitable and universal access to improve the sanitation at community level. Now, in the public space, what have we been doing? I've moved away from community.